How long does it take for topical minoxidil to work? And do you have to use it forever? What is the safe concentration for women? Today, I'm going to answer some of the most frequently asked questions that I get on my social media on topical minoxidil for treating hair thinning. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. If you enjoy learning more about hair care, hair-related content, as well as how to maximize hair growth, then consider subscribing to my channel and I would love it if you can give this video a thumbs up. So I've talked about topical minoxidil in my previous video on hair care and hair thinning. And certainly as a dermatologist, this is one of the most frequently recommended products I tell my patients who are going through hair thinning, and really one of the most effective that's available without a prescription. Minoxidil, aka Rogaine, well known by its brand name, is FDA approved for treatment of androgenetic hair loss or female and male pattern hair loss. And over the counter, you can find two concentrations, 2% and 5%, as well as two different formulations, solution and foam. Minoxidil seems to work by improving blood flow to the scalp, as well as prolonging the anagen or growing phase of the hair cycle and shortening the telogen or resting phase. And although it's only approved for a pattern hair loss off-label, I actually recommend all my patients who are experiencing hair loss, regardless of the type, to try this if they're able to. So in particular, patients who have telogen effluvium or stress-related hair loss, alopecia areata, or even traction hair loss, they're wanting to try something to stimulate hair growth. This is one of the products that I recommend. Now, minoxidil doesn't work well in everyone, and there is a variability in the response, and that is because for minoxidil to actually have those effects on improving hair growth, it actually has to be first absorbed into the scalp and then converted into the active drug or active form called minoxidil sulfate by an enzyme that is found in our hair follicles. And unfortunately, this enzyme actually varies in activity, and it's really based on genetics, which is why some individuals have a great response while others have really minimal to no response despite continued and consistent use. Now, I'm not going to dive too much into detail in this video on how to enhance minoxidil's efficacy, and you guys may have seen on social media like TikTok using tretinoin and microneedling. And certainly if you guys are interested in learning more about those, comment below and let me know. I'd be happy to make a separate video on that. Today, I'm mostly going to focus on the most frequently asked questions I get on using topical minoxidil, as well as expectations with use. So let's get into those. Number one, the most frequently asked question I get is, can women use a 5% concentration? And the answer is yes. Now, I get this question a lot. I think it's because on the men's version, the 5% Rogaine in particular, there is a warning on there that says do not use in women. And that has to do really with the patent around Rogaine itself, because there is a women's formulation from Rogaine that is 5%, as well as other brands that make topical minoxidil 5% that don't have that warning. And this really stems back to the fact that actually Rogaine holds a patent on the 5% formulation, but only for men. And that is really why there is a warning on the men's bottle. So yes, if you're a female, you can absolutely and you should be using the 5% concentration. In fact, studies have shown that between the 2 and 5%, the 5% hands down performs way better and is a more effective compared to the 2% despite your gender. So regardless whether you're men or women, just get the most affordable 5% that you can find and use that. Now, the reason why I say that is there's literally a pink tax on women's Rogaine 5%. Even though it is exactly the same formulation as men's Rogaine, it is like twice as expensive. So I just tell my female patients, if you're interested in using topical minoxidil, just get the most affordable 5% out there. It doesn't have to be Rogaine. It can be any generic brand. In fact, Target, CVS, they all make 5%. Now, you do want to be careful is because I mentioned earlier, minoxidil comes in solution and a foam. The solution can be quite irritating for some individuals. Often in that liquid formulation, there's propylene glycol as well as alcohol just for the vehicle stabilization. So if you find that the solution irritates the heck out of your scalp, consider using the foam. The benefit of this foam is that it's less irritating. It is slightly more greasy than the liquid, but I also find it's easier to apply, and you're gonna have less difficulty having the liquid running down your face and getting it on your skin, other parts of your face that you may not want excessive hair growth on. The next question is, how long do I have to use it to see visible results? Now, it usually takes about 3 to 6 months of consistent daily use before you start to see improvements. For some individuals, it may be sooner, and for some individuals, the result may be slower. And that has to do, again, going back to the chemistry, the enzyme, and that enzyme we know actually varies in individuals. But if you are going to give topical minoxidil a try, I recommend at least 3 to 6 months of consistent use, and this is applied daily to where you need it. So if you've used it for more than 6 months and you have noticed a mild to minimal improvement, then most likely you're probably one of those individuals who don't have really high what we call sulfotransferase enzyme, the enzyme that converts minoxidil to the active form, and therefore continue using it probably does not make sense. But there are other options available over the counter, like low-level laser therapy that can be combined with minoxidil, or even oral medications that are going to be more helpful. So just because topical minoxidil didn't work for you, it doesn't mean that you don't have other options. It's just that those options may either be more expensive or require a prescription treatment and requires you to see your dermatologist. Now, along the same line, if you have been using it for 3 to 6 months, have noticed some response, but really want more and you don't feel like you've truly maximized your hair growth potential, this is again where you can pair it with other treatments like low-level laser therapy, prescription medications like oral minoxidil, or finasteride, or spironolactone. So even if you have response, but still not as good of a response as you're hoping, you can certainly pair with other treatments. And that's really the beauty of topical minoxidil, is that it is somewhat flexible in the sense you can and you should use it with other treatments to really give you the best results possible. So the next question is, will I experience that scary initial shedding of hair in the beginning? If you guys are not familiar, one of the scarier side effects that's temporary when it comes to using topical minoxidil is in the beginning, a group of individuals will experience this aggressive hair shedding. And that has to do with how minoxidil works. So if you guys remember, I mentioned one of the ways minoxidil works is it prolongs the growing or the anagen phase. And we all have hair in different parts of the hair cycle. So some of our hair are in the resting and shedding phase, and the majority of our hair is in the growing phase. Well, to grow hair, we actually have to push out the old hair to push those new hair follicles into the growing phase. And so to do that, minoxidil kind of synchronizes those hair into the growing phase. And so you have this initial response of hair shedding that is somewhat scary, especially if you're already having hair thinning. But in a way, I actually view that if you are experiencing it as a good positive response to minoxidil, because if minoxidil wasn't working for you or you're not a responder, then you're not going to see that initial shedding. So even though it's scary, it is temporary, but also it means that you are responding to topical minoxidil. Now, going back to the question, it's really hard to predict if you're going to have a lot of shedding, and then if so, how much. Everybody responds differently because of that variability in that enzyme. And with that, you can still have response without aggressive hair shedding. And for some individuals, you may notice that aggressive shedding before you start to see good regrowth. Now, understand that if you do get that scary shedding, it is very temporary. Usually happens within the first month or so. And if you continue, that shedding will stop, and then you will start to see hair regrowth. The next most frequently asked question is, do I have to use topical minoxidil forever? And the answer is, it depends. It really depends on the hair loss that you're treating. Remember, male and female pattern hair loss is a progressive condition. There is no cure. So what that means is if you do nothing over time, your hair will start to thin out in areas that is commonly affected. So the top of the head, the frontal, and the bitemporal hairline. You're not going to go completely bald. Often individuals have preservation of the sides and the back, but if you choose not to do anything, those areas can over time gradually thin out. And because androgenetic hair loss is progressive, that also means regardless of what treatment, whether it's topical minoxidil or oral minoxidil or oral finasteride, it is going to be a chronic and long-term treatment. But if you're experiencing a temporary type of hair shedding, so for example, stress-related telogen effluvium or postpartum, or say chemotherapy therapy related or traction hair loss or alopecia areata, where often it's more of a temporary type of hair thinning and is not progressive and long term, using topical minoxidil can help jumpstart your hair growth, but you don't necessarily need to use it forever to retain the hair that's grown on topical minoxidil. Then going to the last question is, will I lose all of my hair that's grown on minoxidil if I stop using it? And again, this really depends on the hair loss. So for androgenetic hair loss, as I mentioned, it is a progressive condition. If you use topical minoxidil and that is the only thing you do and use, you have a good response, and you stop using it after a certain period of time, you are going to reverse back to kind of the natural state that your hair is going to be in without treatment over time. Now, when it's for like telogen effluvium or stress-related hair loss, I would say you're not going to lose everything, but certainly your hair may not feel as full as it was using topical minoxidil, but you're not going to lose all the hair that you've grown while using it, if that makes sense. So again, it really depends on the condition. For progressive hair loss, if it's the only thing you do, you stop using it, you are going to lose all the hair that you've grown. For temporary type of hair thinning, if minoxidil is the only thing that you use, you're going to, for the majority, retain most of the hair that you've grown while using the topical minoxidil. All right, guys, I hope that gives you a little bit of insider on topical minoxidil, answer some frequently asked questions that I get around using it. Again, if you guys want to learn more about how you can maximize or enhance topical minoxidil efficacy, like tretinoin, microneedling, as well as other treatments that you can use alongside topical minoxidil, let me know in the comments below and I will make a separate video on that as well. Thank you so much for watching. I'll see you guys next time. Bye.